It did. Welcome, everybody. We are so excited that you're here for us today for our Zoom lecture meeting, this hybrid meeting that we're having today. So on behalf of the Women's Fund, welcome to our latest Doc Talk. It's our hybrid lunch and learn. We actually have folks in the room eating with us. I hope you at home or at work are enjoying your lunch with us as well. We've got a really insight-packed agenda for you today, and we're just really excited that you all are here with us. So the mission of the Women's Fund is to provide Houston area women and girls with the tools that they need to be advocates for their own health. Our health education classes are unique because they include preventative curriculum-based classes that teach resiliency skills and relate those skills to current health risks. So as you're tuning in today, we invite you to consider the importance of mental health. And that specifically today, we're going to talk about the importance of mental health treatment for our teens and our young adults and our families. We all learned together over the past few months that, and really, I say past few months, like the pandemic was a few months long, past couple of years, placing importance on our mental state is really vital for our entire healthy life, our healthy living. Fortunately, we're experiencing a normalizing of seeing counselors and professionals for help, and we're very excited about what that future holds for everybody. So bringing awareness to this topic and focusing on mental health can potentially open the door to having these conversations with our loved ones. May is Mental Health Awareness Month, but of course we all know that the importance of that is going to go all year round. And as we learn, mental health encompasses emotional, physiological, and social well-being. It influences our cognition, our perception, and our behavior. Imagine someone guiding you through all the stress and anxieties, depressive thoughts that you might have when you were a young person. How would that have affected your life today if you had had that in your life when you were young? After today's discussion, we can learn tools to empower young adults to get help and change the trajectory of their lives. We're going to proceed with the conversation in a moment, but as a reminder, we're always going to leave 10 to 15 minutes at the end of the conversation for your questions. So feel free to put them in the chat as we're talking, as we're thinking about it, so you don't forget your question. Just know that we're not going to interrupt our speakers. We'll kind of let them focus on their conversation, and then we'll ask those questions at the end. The Women's Fund is going to post a video recording of today's conversation on their website and YouTube late next week as well. We're also live right now on Facebook, which is another great way to stay connected. We would love for you to share this conversation with family members, loved ones, friends, if you think it's valuable to them. Before we get started, just a couple of meeting rules. If you're not already muted, please do so at this time. Feel free to leave your camera up. I love seeing everybody's smiling faces, even if you're not here in the room with us. And remember, use that chat box for your questions. We're going to give our speakers their full attention during the conversation, and then towards the end, we'll ask all of those good questions. So excited to have our speakers with us today. We have two experts joining us, both of them from Charlie Health. Licensed clinical social worker Ann Matino is joining us virtually. Hi, Ann.
Hi.
And then Director of Outreach for Charlie Health, Misty Pace-Krall, in here sitting next to me today. Hi. So Ann Matino has worked in the behavioral health field for more than 30 years. Her career experiences include clinical director and executive director positions in psychiatric hospitals, residential treatment facilities, and intensive outpatient environments. Ann is passionate about providing excellent clinical care through supporting and training staff, creating efficient and effective systems, and utilizing evidence-based compassionate treatment of clients and their families. Misty Pace-Krall graduated from Texas Women's University with a degree in psychology, while her entrepreneur spirit drove her to create a successful educational series in Houston and San Antonio called the Mommy Series. Her love for education and mental health combined led her to Charlie Health. Pace-Krall's life mission is breaking barriers to access to care with Charlie Health services. She's on the mission to eradicate our mental health crisis. I can't think of better experts today. I love the passion about this. So we're going to dive into all things mental health today, and I really hope that all of us kind of come away with a little more knowledge and just a better understanding of kind of the challenges that we're facing. So as we start today, we're really going to focus in on young people, teenagers, young adults, families. Ann or Misty, whoever wants to kind of start, why do we really want to focus in on that group of people?
Yes, well, great question, why we would focus on this age group. But I'm going to let Anne, from a clinical perspective, talk about why we are focusing specifically ages 11 to 30.
Sure. So we've got an epidemic on our hands of suicide in the United States. And it is, we are fierce about driving that down at Charlie Health. And that's really why we started treating adolescents and young adults, because of that high suicide rate and because of their inability to find intensive outpatient programs when they need them. So in every state, there are barriers for kids and young adults to find intensive treatment. And so that's why we started Charlie Health. And that's why we're fierce about doing what we do.
So talk a little bit about Charlie Health, because as Misty and I were talking about, Charlie Health is not something that I had heard of before. And I don't think it's just because I'm not in your space. You guys are relatively new.
Yeah.
So talk about how you guys got started, what makes you guys a little bit different too.
Yeah, I'd be happy to. So we are new to Texas. So that's probably what you were just hearing about us. We arrived August of 21.
Oh, wow. Super new.
Yes, super new to Texas. But we did start in Bozeman, Montana, January of 2020. So we jokingly say that we were cool before, virtual services were cool. But starting 2 years ago, really, it's been pretty fast and furious. The pandemic really did highlight that mental health crisis, but we were in it way before. But it's just nice to have the conversation now at dinner tables to be able to say, I'm taking my anxiety medication, I'm taking my depression medicine. So the conversation is, a little bit more, not as taboo as it used to be. So I'm thankful for that. But our intensive outpatient program is an 8 to 12 week program that offers 11 hours of therapy a week. So that's really the intense part of our program, is those 11 hours. I'll break down what those 11 hours look like. So it's 9 hours of group therapy, and then 1 hour of family therapy and 1 hour of individual therapy. And you did ask what sets us apart. We are 100% virtual. Oh. So that is the access that it can literally be at your fingertips, tablet or computer, so that you can have access to care.
Wow, because I heard you say you guys got started in Bozeman, Montana. And of course, my first thought was, wow, there's probably not a ton of care to be had.
No, that's why we want to reach these rural areas. I mean, the care, and sadly I can speak to Texas and, the percentages here, and we are a 92% desert here in Texas. Wow. Can you believe that? I mean, you would think that we would be more with having Dallas, Houston, San Antonio, these large cities, but we're only servicing 8% of our community.
When it comes to mental health?
When it comes to mental health.
Wow.
Yeah.
That's amazing.
Yeah.
So you mentioned you're 100% virtual.
Yes.
I'm guessing there are a few people who think maybe you have to be in person to give this kind of therapy, and shaking your head. Yes.
I kind of used to be one of those people. I think that for those of us who have been in mental health for a really long time, when we started thinking about just virtual, we thought, what are you talking about? We couldn't possibly be as effective as in person. And that's not what studies are showing. In fact, the studies are showing that when people are in the comfort of their own homes, they can connect. They can form relationships and connections, and it's the isolation that's really killing kids, and it's serious business. And so what we find in our groups and in individual therapy as well is kids are connecting, they are forming relationships, they are learning skills. It's working, and more organizations are finding that out. One of the things I was thinking of as Misty was talking about Texas, as the clinical director for Texas, is that, early on when I started with Charlie Health, I talked with a hospital who was just so interested in hearing about what we had to provide, because they were saying, we have kids who are coming in here who have either attempted or who are thinking of attempting suicide. And when we discharge them, there's nothing, or there's maybe 1 hour of therapy a week. And that's really not indicated for that level of severity of mental health symptoms. So, they said there's no place within 50 miles. So that really, impacts us every day when we find out, when we're talking to our kids who feel isolated in where they are in the United States, but they don't feel isolated when they come to Charlie Health.
And the other thing I think about too isn't just kind of a physical access, to places. I live in a place that maybe doesn't have as many facilities, but it's also difficult to get in to see a professional in person.
So the wait list is also a problem too. And so that's what we're really proud of, is that when someone calls in, we take a biopsychosocial evaluation. We are able to take age, need, and any outliners and put them into a group with 6 to 8 other individuals. So we still keep it small. But they're healing with a like need. So they can also say need too and connect with this peer. So not only are they getting support from individual therapy, our family therapy, but they're also getting peer support that's really great.
Yeah.
So our curated groups are amazing. We actually have over 40 different tracks.
Wow.
So we can get really specific on the need, which is also sets us apart from other programs.
So I'd love to talk a little bit about how if a person in your life needs intervention, needs therapy, because, as a mom, I have an 8-year-old and I'm super involved in her school. And I'm talking to the administrators, and almost every teacher administrator I talk to says that a large number of their students this year are struggling with some sort of mental health issue, whether it's anxiety, depression, and they're seeing it more than they had ever seen it before. But how do we know, as parents or caregivers or friends, if we're to the point where they need to go see somebody?
Yeah.
Sure.
Yeah,
I think it's really important for us to realize, as parents and members of the community and people who work and all those things that we are as adults, that we are also experiencing those issues as adults. And so I think it starts with kind of making sure that you have an idea or somebody to talk to about what you might be struggling with. And I think that it's true that the pandemic has made mental health access something that more people are interested in finding. It's really hard to find therapists. It's hard to find psychiatrists. But I think that we need to realize that as adults, what do we need? Where are we finding that we are struggling with depression or anxiety, and being able to identify that and help ourselves? It's almost like the oxygen thing. We do have to look at what's going on with our kids. Behavior changes, changes in status of, not doing well in school when you did well before, not reaching out to friends when you've reached out before, staying in your room, isolating. This can be a tough one with technology, because technology equals relationship. And is it real relationship or not? That's a whole nother probably podcast, but how much time are kids spending in front of screens and not in front of people? And, any eating habits also is something really to look at, as well as sleeping habits. There's a new study that just came out that talks about how lack of sleep in our kids is directly affecting their depression and increasing their thoughts of suicide. Kids need a lot of sleep. And a lot of times schools are starting really early. They've got a lot of activities afterwards, and they're not getting enough sleep. So those are just a few of the things to look for.
Yeah. And so I think back to how do you know when it's to the point? You could look at your child and say, oh, they're maybe not doing as well as they did last year in school. Are there kind of warning signs, or do you just have to kind of tap your gut and go, hey, this might be beyond what I can handle as a parent? Or does it start there? I mean, does it start with, as the caregiver or parent, having a conversation?
Sure. I do think it starts with having a conversation. And I think that there's a lot going on in schools where kids are coming home and saying, you know, this is my friend went to the hospital or this or that. Those are good places to start also, if they're talking about their friends and their peers that are struggling. So why do you think they're feeling that way? What do you think they're feeling? You know, how can you support them? And you can start that conversation by talking with others. Just depends on your relationship with your child. But I think the best way is to talk to them directly and say, hey, this is a really tough time in the world. There's a lot going on. You've got a lot of support. We love you so much and all that. And asking the direct questions. Have you thought about killing yourself? And you know, you can say, you know, you thought about hurting yourself, but it's hard for anybody to do unless you're a mental health provider that knows how important it is to say directly, have you thought about killing yourself? And so that's something that may be shocking or uncomfortable for parents. Maybe one parent wants to, it's easier for them to say than another parent, depending on their relationship. Maybe they want to come together and say, you know what, we were watching something that said, this is what we should ask you. You can say that too. So it's not just that you know, there's some support for mental health for kids. And we want you to know that these rates of how kids think about themselves are really skyrocketing. And, you know, we just wonder how you're doing with that. You know, another thing is to talk to kids about their body image. You know, how are you feeling about your body? Are you eating healthy? Are you, and the lack of shame and the just understanding to listen to your kids, not to dictate. That's so hard to do. But if they can sense that you're listening to what they say, they're going to tell you more.
Yeah. Well, and I love this conversation of like really having maybe conversation before we get to that point. You know, that the second you notice something with someone, one of their friends or one of their classmates, and making it a safe space for them to talk about it, even if it's not in that moment.
Yeah. Right.
Yeah.
Absolutely. Yeah.
All of us are going to go through something.
Yes.
Right. I mean, I feel like that's also part of the education is it isn't just about intervening when we have a crisis. It's about knowing that someday we're all going to have some sort of crisis.
Right.
Sure. And I think it's important to realize, you know, I get very emotional about this because it's really important to talk about. And also it doesn't mean that every kid is suicidal. You know, I mean, I'm starting there because that's really impactful. That changes lives. And that's what we want, you know, that's ultimately the most important thing is to prevent suicide. And there are kids that are experiencing mild and moderate depression or anxiety, and they don't know what that is. They don't know what it looks like. You know, how are you in touch with your body? How are you feeling? How are your shoulders? How is your stomach? Like, are you noticing that they have social anxiety? A lot of kids are experiencing social anxiety going out in public. And so what does that look like? And what does it feel like? So really talking about feelings is important. And I think if parents have an opportunity to just Google like feelings wheels, a lot of kids will say, how are you feeling? Fine. Right? That's what a lot of us start saying. They don't know that there's a huge array of feelings out there. And so if you just Google feelings wheels, you know, I've mentioned this to families before too, is that you pass the feelings wheel around, you say like, how are you doing? And there's lots of different feelings to choose from. So I think it's important to help kids get that and parents get that idea of how they're feeling.
That's really interesting. Wow. So what if you start having this conversation? You mentioned like, well, what if a different parent or a different caregiver is maybe not so on board with the conversations? What if you get pushback from your child, from your family member that you're trying to talk to? You know, they're like, hey, no, I'm fine. And they keep insisting, but you know that it's not fine.
I'd say, let's just make sure. Let's just ask some questions. Let's be curious. You know, and again, you know, blame the pandemic, blame the fact that you saw something on TV, blame the fact that you saw a famous person talking about their mental health issues or a famous sports figure talking about their mental health issues. So bringing that to being a regular type of conversation to have, you know, is really important. The other thing is, you know, sometimes kids will relate things to one mom and not to their own mom. Or they're talking about things like, that they've heard about at school, or ways that they're feeling, and it's not at their own house. Maybe they're talking to somebody at somebody else's house, at their friend's home. And when you're a parent, what do you do with that? That's the other thing. Do you feel comfortable saying, hey, I just overheard there were some hard conversations going on, and I just wanted to let you know? I think that's super important.
And so you would say, yes, we need to be, as parents, talking to each other about
Right.
hearing our kids talk about.
Right. Absolutely.
So I heard earlier in the conversation, we were talking about how, of course, you guys are operating virtually, and group therapy is a big part of that. I also heard you say, Missy, that families are part of that therapy. So talk about the role that families play. I know we've been talking about that pre-intervention role that families play. What does that look like when you actually get into therapy?
Yes, I'm going to actually let Ann talk a lot to this, but I do want to identify what our family therapy looks like. As you know, every family looks different. And so you do get 1 hour of family therapy, but know that you can choose who you want your family to be. It can be a chosen family. It could be mom, dad. It can be aunt, uncle. It could be grandma. It could be the cat and the dog and, your best friend. So just know that family really is for who that person is wanting to heal with, or the family member that is supporting their mental health and going through the process. But I will let Ann take it from like the family perspective and what we do in family therapy.
Yeah. And we see adolescents through young adults. So we have spouses in family therapy too, of some of our young adults. So you're right. I mean, family is whoever you want it to be and need it to be. We want to see families understanding that they all have different dynamics. Look at families with respect and compassion, and not with shame or guilt about what your parenting styles might be. That isn't helpful at all. So what I'm super proud, and I know Misty's heard me talk about this before, is that we do offer family therapy once a week as part of our IOP program. But what we also know at Charlie Health is when families are involved, kids do better. Period. And so what we've done is we've expanded our offerings. So during the IOP process and afterwards also, parents have the ability to come to parent support groups. We have a once a week skills group for parents that they can attend. We've got a kinship support group. So grandparents or foster parents that have kids who are experiencing challenges. We've got a siblings group. We've got a multifamily group. We have a variety. Oh, we have TLC. So taking care of yourself. We've got yoga for parents. So what we want to do is we want to provide parallel services to the skills that we're providing adolescents and young adults to their parents so that they can get some relief however they choose to do that. So we offer all these groups different times of the days. We're just throwing up a bunch of things for parents and families and saying, pick something that we can help you with right now, because we know life is rough. If it's family therapy, great. If it's parent support, that's great. If it's taking care of yourself and doing yoga or learning about mindfulness, that's great. Do something with us and let us help you during this time.
Yeah, and I heard you say earlier that kids do better, young people do better when they have the support of someone else, someone who cares about them, kind of walking along with them. Why is that? I mean, I can think practically why that would make sense, but I would imagine there's probably more to it than that.
Well, I would say one of the things is it's extremely empowering to say to kids, hey, guess what? Your parents could use some help too, because they're the ones that everyone's saying, you've got the behavior problems, right? Or you've got the depression, or you've got this. And so by saying, hey, listen, there's a family dynamic here, and so we want to really support your parents too. I've just had kids look at me like, what are you saying, that they can do something different? It's not just me. So I think that's part of it. And I also think that, it comes along with whatever regular adolescence is. I don't even know if we know what that is, that kids feel isolated. They don't feel heard. And so if they see their parents investing in doing something for themselves and their families, I think they really feel seen and heard to a different degree.
So talk a little bit kind of about the nuts and bolts of some of this. So I can imagine there will be people who will be concerned about privacy and confidentiality, especially when we're talking about virtual settings and group settings. Walk me through some of those concerns that people have.
Yes, so I'll start off, and then I would love for us to talk about like our eject plan if there is an emergency and crisis situation.
Yeah.
Really on explaining a situation that has actually happened that she's been a part of. But we use HIPAA Zoom.
Okay.
So there are other firewalls, other protections that they are not able to get into.
Oh, wow. So
And
is this a whole different kind of Zoom?
Yes.
I love this.
So,
No idea. This
so
is awesome.
lots of protection and privacy around that. And of course, we have consent forms and releases and whatnot that are very important and protect the child and protect the patient. But with Charlie Health, of course, safety is number one. And I know that through our program that if we realize at any point in time that they need a higher level of care, then we can put them into a higher level of care. If they're needing like a respiratory treatment center, or they're needing to go to the emergency room, or if there is something that needs to be done immediately, those plans are in place. But we'll give you kind of a picture and the overview of what our group therapy looks like, and how we do what is like our main room, and then they break out into the groups. And then we have 2 therapists that are in the main room at all times. And then, Anne, would you like to walk them through what that looks like should they need to a patient out?
Sure, absolutely. Speaking a little bit more first to the confidentiality piece of it, we do try to get our kids to be wearing headphones. So that helps a lot. We also not only encourage, but require that they're in a confidential setting. We've had some situations where like parents are so nervous or hypervigilant because of what's gone on with their kids that they want to be in the room during treatment. And it's not appropriate, because we want the kids to be able to, be vulnerable, grab skills, talk with people, and receive feedback without worrying about that. So we do ask them to be in a confidential setting. In terms of the safety piece of it, we have a lot of processes around safety. So we use a communication system, where, as Misty described, there's a front room where therapists come in, and then they're put into breakout rooms, and then kids come in, or young adults, and they're put into their group. And I sometimes describe it as like a Verizon sign, like there's the Verizon sign, and then there's all those people behind it. And so there's a bunch of people, case managers and therapists and helpers of different sorts, peer advisors that stay in the front room, and they're monitoring for safety. So they can come into a group if a therapist sends an immediate message and says, hey, this kid is really struggling, could you pull them and check on them? And so we can zap them right out of group, take them into a breakout room, say, hey, so, you're experiencing a lot of anxiety, or what's happening, and then do some breathing exercises and say, oh, what happened in group that was hard for you? And then kind of calm them down, and then back into group. Or if they are feeling, that they really need more than that, we can do safety planning, we can call parents and all of that kind of thing as well. So we're constantly monitoring, and there's an immediate communication system between group facilitators and a number of behavioral health helpers of different sorts that are constantly, at the group. In the group to help out. So yeah, it works amazingly well. And as someone who's worked in psychiatric facilities and residential facilities for many years, I kind of said, what do you do in an emergency when you're virtual? And, we have facilitated kids going to the hospital, calling their parents, staying on Zoom with them, calling hospitals and saying, hey, we're sending somebody over to you right now, calling safety checks. If somebody is in immediate danger, that room of people, right? I could call if I pulled a kid out of group and was talking to them and they were really having a hard time, I could put the name of the kid in, and they can look at the medical record, know what county they live in, know what police department to call, if a safety check, if that's something that's necessary. So we do have a lot of safety protocols that work really well.
Yeah, I had no idea. Like, as you were kind of describing this, I'm thinking it's not unlike a regular Zoom meeting like we're having. You've got 4 or 5 people sitting
Yeah.
around, you have a therapist.
Mhm.
It's not
No.
really that. I mean, it's
No.
much more complicated and nuanced.
We have an army of people,
Yeah.
and we're very serious about it. So,
And in the group is basically what you see here. You're just going to have a facilitator and you're going to have a number of kids, coming in, and, we do some surveys and make sure that they're safe now and then. And, we've got a number of protocols and things like that, but it's not that you're isolated, which is, you've got people at your beck and call that can come to help at any time.
Wow. So I know we've talked a little bit about, some of the logistics of this. What about cost? Because that's often a barrier to people being able to afford any kind of medical care,
Yes.
let alone mental health care.
well, that is definitely one of the barriers that we wanted to break down as well. So access and then financial access, right? So we take commercial insurance and Medicaid. So
Oh, wow.
we take both. Yes, we're very proud of that.
Yeah.
And have worked very hard by state.
Wow. So in every state?
Yeah, nationwide.
Wow.
Yes. So
Anybody who knows what regulation knows
Yeah.
that that's no small feat.
and that's what I was just about to say. I was
Yeah.
like, we have amazing, people in compliance, and I love what they do, and I love what I do, and I stay in my lane.
Yeah.
Yeah.
That's amazing. That's
Yeah.
amazing. So how has this, have things grown for you guys in the last kind of year or so? Are you seeing even more and more families reaching out to you?
Yes. So we are growing fast and furious. So, and of course, we're hiring. You'll see us all
Yeah.
over LinkedIn. We are hiring,
Wow.
but we're growing so fast, and we're just trying to keep up with the demand. It's here, and seeing the demand come in makes us, thriving and
Yeah.
being a good resource. So,
Right. Well, and I imagine, like you said, I mean, you're hiring. I'm sure there are other people listening who are thinking the same thing you guys are. Hey, I'm super passionate about this. This is
Yes.
something I want to be doing.
yes,
How great to be amongst others who have found a new, innovative way
yes.
to make it happen.
Oh yeah, we're
Yeah.
we're very proud of our product and how it's been structured. So from our 3 co-founders, our CEO is Carter Bernhardt, and she has the residential treatment background, and she really was one that saw the gray areas on the front side and on the back side. So she was seeing the re-entry. They would have all the support that they needed in residential treatment, and then they would come out and then they wouldn't have the support. So that really was the start of the conversation for the gray areas, and then also breaking the barriers to access of care. And then our second co-founder is Justin Wise, and his best friend is actually Charlie. So Charlie is a real person.
I know we've been
yeah.
talking a little bit before we got started. I had questions because I hadn't heard of Charlie Health before.
Yeah.
Do you want to kind of share with everybody kind of how the name,
Yeah.
how this got started?
Yeah. So Charlie was the best friend to Justin Weiss, our second co-founder, and he was in a rural area of Connecticut that was actually seeking care and couldn't find it and had an accidental overdose. And so it's Justin's mission to make sure that everybody has access to care. And our third co-founder is Dr. Carolyn Finkel, and she is really our curriculum backbone and has really helped define how the care would actually be structured out. And what I'm really impressed with are the modalities that we have for the need and how we actually choose whether that's CBT or DBT to.
So break down the acronym.
Yeah, sorry.
That's okay.
Yes. So cognitive behavioral therapy
Okay.
and
So that's
biological.
talking, right? Is that talking?
I'm gonna let our clinical director.
Okay.
So
Matching.
yeah, so evidence-based care, cognitive behavioral therapy is based on the idea that you change the way you think, so you change the way that you behave. And so learning things like cognitive distortions, an example of that would be all or nothing thinking, let's say, for example. So let's say we're talking to a young person who's just either it's, they're all black and white thinking, and can't really find the middle and the gray and the spectrum of how to look at or perceive a situation. That would be an example of that. So cognitive behavioral therapy, and then dialectical behavior therapy is kind of a subgroup in a way, or another perspective that was developed actually to treat people that experience borderline personality disorder, but it's also very effective with a lot of different mental health issues. And there's 4 major parts of dialectical behavior therapy. Mindfulness is one. We'll talk about that. Hopefully we'll have some time to talk about that. Distress tolerance, emotion regulation, and interpersonal effectiveness. So I think all of us, when we look at those 4 parts, we'll say, oh, I could use some of that, right? And so there's some very specific ways that we teach kids and young adults in those 4 areas to regulate their emotions, to be more effective in their communications and their relationships, and to really self-regulate. So, and then we have an amazingly robust creative arts and contemplative arts component to our program. So all kids are getting music, art, drama, yoga, all of those areas as well. So, yeah.
Why is it important to have art mixed in with our mental health care?
Some kids can't talk. They can't talk about it. They can't formulate the thoughts or the words, but they know the way they're feeling. And it's not only kids, it's adults too. And so art gives us a way to express things that we're feeling and to get things out that are stuck inside. And so, something that I've never seen done at another IOP, and there's a number of those things at Charlie Health, but we would have, for example, a therapist who was seeing an individual client and they were realizing, they're really into music, but they're just not talking. We just can't, get them to start, working on goals or even name goals. And so they can reach out to our creative art group and our contemplative art therapists and say, can someone join me in a session? And this is what's going on with this kid or young adult. They can't do this. They're struggling with this, blah, 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 blah. And then our department will say, oh, this would be a great activity for this young person. And we'll come into the session, actually do it and facilitate it, as well as doing the groups. So that's a pretty cool offering.
That is really cool. I want to go back to, you told the story about how Charlie Health was named by a young person who accidentally overdosed. How does addiction and drug and alcohol use, how does that play into some of the therapy that you guys provide? Because I know there's so much overlap.
There is.
Thank you for recognizing that.
Great question.
Yeah. So, when years and years ago, there was one department that was substance use and the other department was mental health, or different floors or different buildings. And what we know is that they're really tied together, right? And so, at Charlie Health, we're primary mental health, but we do deal with kids and young adults that have substance use issues. Not full-blown issues where they maybe need to go to detox or whatever, but what we know is that there's mental health issues under that, or as I say, like if you look at like a house, the foundation, what is the foundation that is making substance use a solution? And so if we look at that and say, okay, so there was some trauma when the child or young adult was young or was growing up, we want to look and find what the foundation is in terms of mental health. So when we're treating that, it's going to affect the substance use also. And then we do have specific, motivational interviewing and other kinds of techniques that we use to help kids and young adults work on harm reduction and work on sobriety. And those are 2 similar things, but not exactly the same. But again, safety is number 1. So yeah.
I want to let everyone that's with us virtually, we have a few folks in the room too, if you have questions, I'd love to see them in the chat so that we can make sure that we get to all of your questions and answer anything that you have. I have a question to kind of get us started. You mentioned mindfulness, And you said, I hope we get to talk about it. So let's just talk about it. So what do we want to talk about?
Well, I think similar to kind of yoga. I don't know if you guys remember when yoga was like, that's just like for certain people. It's like, or woo woo, or however you want to talk about it. I live outside of Boulder, so, a lot of yoga going on here. But, mindfulness is evidence-based. So being able to focus, stay with your thoughts, breathing. I mean, I've heard years ago, I heard somebody say that breathing is going to take over for therapy one day, just having people learn how to breathe right. So there's a lot of different breathing exercises that you can do, but calming your mind and your body, and assisting with stress reduction, and being able to focus and ground yourself when things around you are swirling. And we know that that's the world that we live in. So mindfulness practices, those are just some of them, are extremely important. And sometimes kids and young adults, they'll grab onto one thing. It won't be everything that they'll feel comfortable with. They'll really like yoga, but they don't like breathing, or they really, like focusing and grounding techniques of some sorts and not others. The thing is, find what makes sense for you. And I don't know if you've seen this, but I mean, there are a lot of schools that have kids doing breathing, mindfulness, focusing, and non-judgment. I should say that right. Looking at things with curiosity rather than judgment. And those are just some of the pieces of mindfulness that are helpful.
I love that. And I love that we're starting that. At least some places are, with our young people. So you don't wait until you're our age trying to figure out, what is this? I'm asking the question, like, what is mindfulness? That's not something that was taught to me as a young person. I love that it's becoming a little more of a mainstream idea. Yeah.
Right.
Quietly for a moment. We don't always have to be doing 15 things.
Right. And there's a lot of things that are free. A lot of mindfulness is free. Therapy's great. Medication sometimes is necessary, but there's a lot of, calming techniques and things that can help kids and parents with stress reduction that are free.
So you mentioned medication. So talk about how that kind of weaves into your therapies. I mean, you have doctors, for people who are licensed and can prescribe medication. So we're not only talking about limited therapy that you guys are providing. Correct. Is that correct?
Yes. So we can do med management through the program, but once they are out of the program, we will find a psychiatrist that is in their state, and that's just law. But what we have are our discharge planners and our case managers that are already working on, if they do need that med management piece, then we are already seeking help in their state. So, and Anna, if you want to speak a little bit more to it, please.
Yeah, I'd love to. Boy, I love this stuff. So it's so fun to talk about, really. So, what I say about medications is this. There's medications that are indicated that can really, really be helpful in alleviating symptoms of depression, anxiety, and other mental health issues. You don't have to be on medication for the rest of your life, most likely, right? Just like with anything else, if you had another kind of medical condition. So if you have a heart condition and someone says, here, you have a biological condition, and this is good medicine for you to take, you're going to say, okay. So I think things are turning around, and I'm really happy about that in terms of depression and anxiety specifically, saying that, hey, listen, I'm at a point where I'm not able to function right now. My functioning, is not working at school, at home, with my relationships, at work. Something needs to happen, and I can't make it happen. Just like you can't change if you had a heart issue, you're not going to be able to change it if it's a biological depression or anxiety to that degree. And so it's a good idea to get a consultation for medication, and knowing that some people want to will themselves better and they think taking medication is a way out. They don't want to do that. What I would say is get a good consultation, get a second opinion if you would like, and pair medication with treatment of some sort. So with therapy, what we know is that's evidence-based, medication plus therapy or treatment in alleviating symptoms. And sometimes medication is good to just bring someone to the point where they can take advantage of skills. If I'm so depressed that I can't do mindfulness, or I can't learn the skills that a therapist or a program are teaching me, then I need to get to a point where it can open me up so that I can receive the skills and start practicing them. So that's one of the ways that I describe medication, is it can kind of bring you to the area or to the point where you can accept help and you can start helping yourself.
I love that. We do have some questions from folks out in the world. One of the questions is, how long does it take to get through signing up and then actually starting treatment? So from that evaluation, from when you make that first phone call.
Yes, so we take the biopsychosocial evaluation. Once we do that, we also get your benefits. Pending verification of benefits, you can be within group in 24 to 48 hours.
Oh, wow.
Yes, so
Is that
very
that feels fast to me. Is that faster than it might happen other places? I mean, you've worked other places, Anne. I mean, you know kind of what the rest of the world looks like. That feels fast to me, not in a bad way.
Yeah, no, I mean, I think that it's our mission to get kids and young adults better treatment faster. We want to get people in. If you need this level of care, we want you to start this level of care. And so we'll do anything we can to make that happen.
Yeah. One of our other questions, the person is saying, they don't necessarily need services, but how can they refer someone or even kind of spread the word about what it is that you guys offer and how you guys are different? What would be a good way of sharing that with others?
Well, thank you so much for asking that question. I mean, if you're in the behavioral health world, you can admissions at charliehealth.com. Very easy. We do have a fax number, and then of course our website as well. So you could immediately go onto our website and click on Get Help.
Yeah, I can just imagine. I'm just thinking about all of the teachers that I know, and there are just so many people I think that are encountering young people every day that I think would be very surprised in a good way to know that you guys are out there, and it's just so different from I think what we all traditionally think of as mental health services.
Exactly. Yeah. A lot of people think that it's just telehealth and that it's going to be a one-to-one service, but this is more robust. This is definitely intensive outpatient program. This is 11 hours of therapy a week for 8 to 12 weeks. One of the things that I was very impressed by is that we are not a stop or an end to care at the 12 weeks. If you need to extend that time, we are able to extend those weeks. So it really is based on the needs of the patient, and we want to make sure that they get everything that they need.
Yeah. We have another question. The thought of unraveling underlying issues gives me an overwhelming feeling. What advice do you have for those who need to make that first step to heal and start the therapy journey?
That is one of the best questions, Chloe, I've heard. That is an excellent question. Where to start? And I think what I'd like to talk just a minute or so about is level of care. So in behavioral health, just like in medical health, we have to find the right level of care. So if I cut my finger, in the kitchen, I probably don't need to go to the emergency room, right? You want to choose the right level of care for what you need. And so I think it's important to realize that for behavioral health, you've got like the once a week therapy, and that's fine for many, many folks. And that really works. Or sometimes twice a week individual therapy. That could be an option. Then usually after that, you go up to the intensive outpatient programming, which is 9 hours of group and then additional treatment. And then there's residential treatment, which is usually 30 or 60 or 90 days. There's hospitalization for emergencies. So I think when you're looking at, there's a lot going on with me and I have no idea where to start. I think one of the best things that you can do is, if you do have insurance or a mental health center, is just get a consultation, is call your insurance company and say, hey, who can I talk to about what is available to me? Because if you have insurance, you should be able to use it. So are there therapists in my area that I can call? You should be able to call a therapist and have at least a 10 or 15 minute conversation or 5 or 10 minute conversation and say, hey, this is what's going on with me. Kind of is this something that you're aware of? You can also go on Psychology Today and look at specialty areas of therapists. If you want to call Charlie Health, there are a number of clinical directors like myself who are available to answer clinical questions. We just want people to get the help that they need. So feel free to reach out to us also. And the admissions folks can find a clinical person for you to talk to and kind of help gauge like what you need, like where
Just
you
pin it.
and how to start.
You pin it. You know, your room looks much nicer. Hope and tile. Because there was like ant started doing more. It was
Oh, Hope, do you have a question?
go. Why you put it there? Hold on. Lift it.
So it- right? I'm not sure if Hope can hear us to mute her microphone.
Oh, we're not surprised by
We got
this. By
this.
the
We got
way.
it.
Yeah.
No, like it's real life. I mean,
It is real
I
life.
mean, how many of us have had a Zoom meeting,
Oh,
where a
So
kid
many.
runs by, a cat decides to
Yes.
sit on top of my computer?
Oh, yes.
That may just be me, but I feel like
Yeah.
we've all had
Oh,
these
no.
experiences.
I'm like, we're familiar with it. And I are just
Yeah,
like,
and then you conveniently turn on the AC without letting me know.
but I would say that I was super surprised to learn.
Go fuck yourself. You just like
Well. Shit. Okay.
Okay, all right. Well, haven't heard that before, but that's new. Some flavor and
Yeah, I love it.
today's,
There you go.
podcast. But I would have to say that going back to the
Yeah.
resources, super, super surprised that that they really mean that they want to help. So
Yeah.
even those that we cannot admit, we find the best choice for them, or at least 3 to 5 different resources that would be fit for them.
Yeah.
And so it doesn't stop. I mean, we are a dog with a bone. I mean, we are serious about getting care. So, and is a testament to it, because we've had some specialty cases that I've learned about. And then of course, it just helps me to learn about other resources that are just not in Texas, but nationwide that can really help. So we are about partnerships through and through.
Yeah, I love that. So what do we not talk about that you guys feel is so, is important? Something that I didn't ask you about, that one of our folks joining us didn't ask about, that you guys you think we need to know?
I would say that Anne did a great job on talking about the family groups, but they are free groups, even if you are not a Charlie Health patient or parent. So we offer these groups openly to those that just are looking for a resource right now. So I would say another proud, moment is the fact that they're offering it free.
So how do you find that? I mean, is that you just go to your website and you kind of look for family groups?
Yes, so we do have some links that we can
Okay.
share, and happy to do so
Yeah.
afterwards.
So I can
Yeah.
also see, to Chloe's point of, how do you get started? I can also see that being an entry point for some people, like, hey, let me check this out and see what this therapy world, is all about.
Yes, and I would love it. Anne, could you speak briefly about the group that you started about 7 months ago?
Yes, I was just typing that in the chat. So, okay. Yeah, we started a survivors of suicide group, support group. It's the first and third Friday of every month, and it's open to anybody in the nation. So it's just because we've heard that need is there, and I do facilitate that group, and yeah, anybody is welcome to join, and you can get that information from Misty as well.
And talk about why you guys started that group specifically.
We want to be good community members. And so this isn't about Charlie Health. It's about the fact that people need some place to be, that they can talk about things that other people haven't experienced, something that's very traumatic. And so, we have a huge passion for saving people's lives and helping them get better and get through. And so, yeah, it just came out of that. I mean, actually, it was people that were, that work with Misty that were out there hearing, and people are like, we really need a place to go to talk about this. We're like, okay, we can do that. So we want to be good stewards of being human beings as well as, having a business. It's more to us about people's health,
Definitely. And, going back to groups that we offer, it's really special to see a company that really does mean that they want to break down the barriers. Even though we have these free groups and then 40 different groups that are curated within our IOP program, if we do not have a group, and let's say for a hospital or an organization, and it's not fitting their patient population, if they have 4 or more, we will start a specialized track for them. So that's what I'm saying, like barriers, ask me, and honestly, Charlie Health will probably say yes.
Yes.
So we mean it.
Yeah.
I noticed one of the questions here about the time.
Yeah.
That's a great question. So
Yeah.
thank you so much for asking that. For our adolescent program.
Yeah, so we're talking about what days and times
Yes.
of the week you offer therapy.
Therapy. Thank you.
Yeah.
I was like,
I realized
I read it
everyone
and I
else
was
can't see
like,
that.
right,
Let's just
exactly.
include me.
So we do offer a flexibility track. And so typically you see a lot of outpatient programs that are set for certain days
Yeah.
and certain times. So it's a little bit difficult, getting there on those set days and times. So for adolescents, that is 11 to 17, we offer Monday through Thursday and Saturdays after school. So you get to choose. So whatever fits your schedule, if you have an extracurricular activity that you really enjoy and it doesn't fit your schedule, then you can just choose Monday and Thursday and a Saturday. So we really do want them to have that flexibility. If you're a young adult and that's 18 to 30, then we open up the mornings and evenings, same dates, Monday through Thursday and Saturdays, so they can choose
That's really awesome.
what best fits them.
Yeah, it's really wonderful to make it happen.
Yeah.
I know that, Anne, I know you've got to leave us. So we want to bid you goodbye and thank you, because I know you said that you've got a group or something.
Oh, I know, but I am so happy to be here and have a few more minutes if anybody has anything else for me.
I think we've had a lot of questions. Kayla, I'm going to let you pop up and say goodbye to everybody.
Thank you, Anne.
Thank you so much. Take care, y'all.
Hey, so thank you, Anne and Misty. What an informative discussion. We appreciate your expertise on this topic. And now we will leave with wonderful information around mental health treatment, something that we all know is much needed now. We understand that you took time from your busy workday to provide us with this information, not only for those who are on the call, but we do have a recording that we'll be posting, so this is going to have a wide reach in the community, and so we're very grateful. My name is Kayla Rogers, and I'm the program supervisor for the Women's Fund. We are thrilled that you were able to join us today on this Tuesday afternoon for another great Doc Talk discussion, whether you were here in person or joined us virtually. I would also like to take this opportunity to thank Casey Curry for taking part in today's crucial conversation. She always does such a wonderful job. And a huge shout out to Alliant Group for hosting us and to Casey for helping us coordinate all of this. Additionally, we could not have done this without our Doc Talk series sponsor, the John P. McGovern Foundation and the Lindy Haskell Meyer Endowment. Their support for close to 35 years has been instrumental in the Women's Fund success and has helped provide programming or funding for today's programming. Thank you all again for attending our second Doc Talk of the year. We are planning our next Doc Talk for around August or September. So if you have an interest in a specific topic, please let us know by visiting our website, or you can drop suggestions into the chat at this moment. If you enjoyed today's presentation, please like us on Facebook. We are streaming this live on Facebook, where you can stay updated on current events like this one. And speaking of events like this one, we at the Women's Fund have seen firsthand the need for mental health education in our community. And so this fall, we will be rolling out a new program for adolescent girls focused on mental health called Mindfulness. So I encourage that you follow us on social media and visit our website so you can be updated on that project that we have in the works. I also always encourage anyone to visit our website to register for presentations like this and other presentations that we have as well. That concludes today's Doc Talk presentation. So thank you all again for being here. We appreciate you all taking time out of your day, and we hope you have a great rest of your rainy Tuesday afternoon.
Thank you.